Assalamu alaikum warahmatullahi wabarakatuh. Bismillah wa salatu wa salam ala Rasulil Kareem. I welcome you all to our first webinar organized by the Research Unit and Clinical Pharmacy Department. And this is going to be our first very amazing talk by our respectable guest, Dr. Usman Ahmed, inshallah. He's going to speak with you all about optimizing medication management in critical care, a collaborative approach. And it will be starting right now. Prof. Shalam will provide you a brief summary about Dr. Zishan as Dr. Usman as well. So welcome, Dr. Usman. Thank you very much for accepting our offer, invitation, and giving us your amazing talk. We are very thankful to you, and I hope that we can continue these sessions with you in coming semester again as well, inshallah. So thank you very much. And I'll give mic to Shalam to speak briefly about Dr. Usman.
Assalamu alaikum rahmatullahi wa barakatuhu. Welcome to the speaker and all of our colleagues. I'm very happy to be here with you. And also it's a double pressure for me to introduce the speaker. A speaker is not only a renowned personality in our part, in Indian continent, but also he is my student at master's level. He has developed into a distinguished faculty, and I must say an amazing accomplished researcher. He is currently working as a professor at Deccan School of Pharmacy. Also, he is a vice dean, like vice principal, similar to vice dean over there. He's been actively in administrative work and also in the research. He has an amazing research record. He has more than 100 publications to his credit and around 8 patents so far he has accomplished, and many are in waiting. His research field extends from cancer research, drug synthesis and evaluation, analytical chemistry, just to name a few. What I found about him, he has an excellent patents. We will discuss about his achievement in the patents, like intelligent wearable brain-machine interface and artificial bionic eye for visually impaired. This seems to be very amazing research for a person like him. He has been involved in a diverse field of research. We'll be happy to have him to talk more about that. Right now, today, I give the stage to Prof. Usman to tell about today's topic. Okay, how we'll manage the medication management in critical care. It's over to you, Prof. Usman, and also thank you very much for being here and giving your valuable time. Thank you. You may proceed now. Thank you very much again.
So, Assalamu alaikum and very good afternoon, I guess. Alhamdulillah, Dr. Shalam and Brother Hasib, thank you for that kind introduction. Alhamdulillah, with the praise of Almighty Allah, the blessings which has been blessed on me. I'm the student of Dr. Shalam when I was doing my post-graduation in India. And today the day is here that we again are meeting after a long time on a video webinar, and I'm feeling obliged, I'm honored to host a webinar on a topic that is optimizing medication management in critical care. So it's very fascinating for me to host this seminar, international webinar. So directly I will just move on with the topic because we have to get constrained with the time. So inshallah, so I'm excited here to discuss today's topic, and let's start. Alhamdulillah. Well, as healthcare professionals, we know that medication management is a critical aspect of patient care, especially in the high-stake environment of the intensive care unit. Am I audible?
Recording in progress.
Dr. Shalam, Dr. Brother Hasib, am I audible properly?
Yeah. Alhamdulillah.
Yeah, Alhamdulillah. So, with the complexity of the treatments and vulnerability of the patients who are in an intensive care unit, the need for effective medication management has never been greater. So today I will just try to talk on this topic, share insights into how we can improve medication management through interdisciplinary collaboration, the use of technology, and the implementation of best practices. That is the important thing. And my goal here is to provide you with practical strategies that you can apply in your own practice to enhance the patient safety and outcomes. So let us move on. Yeah. So in ICU, medication management is a very critical part of patient care, and ICU patients are often in life-threatening conditions requiring complex treatments and multiple medications. So managing these medications safely and effectively requires a team-based approach. So the collaborative team typically includes pharmacists, nurses, and physicians working closely together. Pharmacists ensure medications are appropriate, properly dosed, and monitored, while nurses administer them and track patients' response. So, physicians will lead the overall treatment strategy. So, together, all of them will ensure patient safety and optimize outcomes. So, today we will explore how this collaborative approach improves medication management and enhances patient safety and leads to better outcomes in clinical settings. Now, the problem statement here is medication errors in critical care. So, medication errors in critical care are a significant concern, we can say, very much concern rather, with research indicating up to 20% of critically ill patients experience such errors. So, it is reported in Critical Care Medicine Journal in 2018. ICU patients often facing multiple complex health issues also require precise and timely interventions, making them particularly vulnerable. And even up to 78% of ICU medication errors involves dosing. That is, can say, while dosing, while giving a dose, that has happening. And medication errors are the leading cause of adverse events or effects in ICU. That is also reported recently, you can see in the recent years. And then the studies also shows that the adverse drug events occurs in approximately 10 to 15% patient in the ICU, and nearly half of these events are preventable. So the most common errors involves were antibiotics, which actually were around 30%, and sedatives, which were around 22%, and 10% increase in the length of stay was happening because of these medication error. So I can say that there are some factors which contributes to the medication error. First of all, there will be complexity of care, like ICU patients frequently taking multiple medications, including high, you can say, risk drugs, like the drugs which are very much risky, that necessitates careful monitoring. And there will be frequent changes in the therapy also. Like sometimes doctors want to change the therapy also. So the rapid changes in patient conditions also requires constant medication adjustment. So they increasing the risk of miscommunication and errors. And then there will be time pressure also, like even like doctors operate under extreme pressure, leading to quick decisions, which also will you can say allow minor oversights that can result in serious medication errors. So, what would be the impact of these medication errors? These errors can range from incorrect dosing to drug interactions, and also sometimes they result in adverse effects, like adverse outcomes, rather, we can say, and that will lead to extended hospital stays for the patients. Like they also need additional monitoring and intervention, and increasing, you can say, the risk of complication in ICU, right? Increasing the risk of infections also, rather. And there will be increase in mortality rates also, like the patient will become very much where you can say the patient will have a risk of losing life also. So it could be even fatal and critical for ill patients. So, suppose if we take an example of a patient with a septic shock on multiple medication, so errors in dosing or failing to adjust for kidney function test will lead to severe complication, such as renal failure or excessive bleeding. So, to address these issues, collaboration is important between the pharmacists, nurses, and doctors. So that team actually, which involves these people, can significantly reduce medication error and improve patient outcome in intensive care units. So let us talk about the importance of collaboration. Why collaboration is important? So collaboration is the key to optimizing medical, you can say, or medication management in the intensive care unit. So when pharmacists, nurses, and physicians work together as a team, you can say, as a collaborative team, they are able to provide the best possible care for critically ill patients. You can say like the pharmacists will contribute as having specialized knowledge about medications from drug interaction to dosing adjustment. Nurses will be on the front line. They will be administering the medications and they will be monitoring the patient responses, whereas physicians will be designing the overall treatment strategy, making key decisions on the course of care. So by sharing the knowledge and expertise, we can ensure that medications are used effectively and safely. So, what are the benefits? Benefits of collaboration will be like data clearly supports the positive impact of teamwork in intensive care unit. Like collaboration will reduce medication error by 30%, which is reported again recently in the recent years, you can say. And medication errors are one of the most significant risks in critical care, and by working together, these teams, the pharmacists, nurses, and physicians, can dramatically reduce these errors and protect the patients from any harm or risk, you can say. There is additionally a research which has demonstrated that collaboration leads to improved patient outcomes. When healthcare professions share their expertise and make decisions collectively, it results in more accurate and effective treatment plans, ultimately improving the recovery and health of critically ill patients. I can also say that there is another research which suggests that there will be enhanced patient safety, which is a key benefit of collaboration with multiple experts overseeing different aspects of care. The chances of missing a critical issue are significantly reduced. This comprehensive approach ensures that every aspect of patient's medical management is carefully monitored. So collaboration here is not only reducing the errors but also contributing to more favorable conditions for patient and the patient outcomes. So these improvements are particularly critical in the high stake environment of the ICU, where every decision can have life betterment or life altering consequences. So this collaboration also creates a safer, more effective care environment by ensuring that each professional expertise is usually utilized to its fullest potential. So this approach directly leads to better patient care, fewer errors, and greater likelihood of positive outcomes for the patient. So, in critical care, where collaboration is, you can say, margin for error is so small, collaboration is not just beneficial, it is essential, actually. So, by working together, we optimize medication management and ensure that our patients receive the safest and most effective care possible. So let us now highlight the role of clinical pharmacists, why clinical pharmacists are important in ICU, like why we should include clinical pharmacists into the team. So clinical pharmacists bring a highly specialized skill set. to intensive care unit, contributing directly to medication optimization and patient safety. So one of our primary, you can say, responsibility is medication therapy management. So, like often when patients are on multiple complex medical regimen, different types of medications. So it is the job of clinical pharmacists to ensure that each medication is appropriately given to the patient according to the patient's condition, without unnecessary overlapping or any risk of interactions between the drug and drug. So this involves reviewing medication orders and collaborating with the healthcare team to adjust therapy as patient condition changes. Next, you can also say that clinical pharmacists also they are responsible for drug dosing and monitoring. So critically ill patients who are having altered physiology, which affects how their bodies process medication. As I told you, like critically ill patients often have altered physiology, and which also affects how their bodies process medication. I can give an example like renal or liver function, which may be compromised, requiring us to adjust the dose and carefully avoiding toxicity or underdosing. So we continuously monitor drug levels and patient responses to ensure optimal dosing. So we also play a significant role in adverse drug event prevention, and we also play a very important role in therapeutic drug monitoring. Like for high risk medications such as antibiotics and anticoagulants, we measure drug levels in patients' blood and as well as we adjust the dose accordingly to maintain the therapeutic effectiveness of the drug while avoiding toxicity. So these were actually some of the important roles of clinical pharmacists. So here is another integral role is the real-time decision making. So which is actually very important to be taken by clinical pharmacists, and clinical pharmacists will perform this role by optimizing medication therapy and contribute directly to improved patient outcome. Now, moving to the strategies, like what can be done.